The most common condition that I see in my clinic is heel pain and arch pain. Most heel pain and arch pain is a result of a condition called plantar fasciitis, which can eventually result in heel spurs. Indeed, the heel is a big, strong bone. It's very uncommon for heel pain to be a result of a condition in the heel bone itself, and we have tests that we can do in the clinic to rule that out very quickly. The plantar fascia is connective tissue that attaches at the front of the heel and fans forward. When it's functioning optimally, it is elasticized. It's designed to give and take as we move. However, if someone is predisposed to a condition of the foot where they're tilted inwards, or worse, if they rotate inwards as they're walking, the plantar fascia will get over-torqued and it gets overstretched and it becomes inflamed. Often the pain is right in front of the heel because that's where sometimes we can get hairline tears. A very common description by patients with this condition is when they first get up in the morning, it's very, very painful. Indeed, that's right out of our textbooks. It's called first step syndrome. If you sit down to watch a movie at night or when you go to bed, the brain sends blood and oxygen to the area to start the healing process. But when we get up again, we overstretch it and re-injure it every single day, and it's quite painful. The next phase of this condition called plantar fasciitis is a heel spur. If not treated, if we don't stop that over-rotation that's overstretching the fascial tissue, it will actually tear away from the heel bone. The body's natural way of repairing itself is to grow bone or to have a calcium buildup trying to reattach to the pulling fascial tissue. That bone growth is called a spur. Now, the pain that happens with this condition is often excruciating, but there's no nerve endings in that calcium buildup. The excruciating pain is a result of the fascial tissue continuing to stretch and tear with each step. Treatment of plantar fasciitis is not complicated for most patients. What we want to do is stop the over-rotation, which is causing the tissue to over-torque, stretch, and tear away from the heel. Further, we want to try to put the fascia in a relaxed position so that it can reattach to the heel even though you're on your feet all day long. At Ortho-Care, we've seen thousands of patients with this painful condition of heel pain and arch pain. Through orthotic therapy, our success rate of eliminating the discomfort is 86%.